Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Welcome back. In this quick tip episode, we're talking about when to use a remote employee versus virtual assistant. I know that a lot of you have outsourced, you've gone overseas, you've gone to different countries to solve problems, and some of you forget that you could have a remote employee. You could actually have someone that is a W-2 employee residing in your state or a different state, or some of you may actually be hiring employees overseas in different ways as well. So I want to be clear that when I talk about a remote employee versus virtual assistant, I'm really referring to this idea of a remote employee is someone that you're employing. A virtual assistant, you're utilizing often offshore agencies in order to conduct a need in your organization. And so with remote employees, it could be full-time, part-time staff member employed by the organization working from a location outside of your physical office. Typically within the same country or region, they're integrated into the practice's structures. They perform core roles. This could be administrators, clinicians, leadership, all different roles, and have access to company benefits, training, systems, etc. They are remote employees. They're subject to the same HR policies and compliance requirements, and they perform with expectations just like an in-office staff member would, often using company-provided devices and collaboration tools like Slack and Zoom and whatnot. One thing that I think is really critical for you to remember, just because you hear a software has the capability does not mean that it's always HIPAA compliant. So you need to make sure that even like a Slack typically is not HIPAA compliant. I believe their enterprise edition can be, but you got to go through certain measures to make that happen. So recognizing that dilemma is really important when you pick your tools. Now, a virtual assistant, for the sake of this episode, I'm going to refer to a virtual assistant as offshore support. A virtual assistant in this context refers to an independent contractor or third-party service provider based offshore. Recognizing you technically could have a virtual assistant that's an independent contractor who's based in the US and they just operate as an independent contractor for multiple companies. You need to recognize that if you're employing a 1099, they have to qualify as a 1099 and they should not be treated like an employee. If you're utilizing a virtual assistant in collaboration with an offshore company, then that virtual assistant should be an employee of that offshore company. They should not be a contractor. And so typically, a lot of us are using this offshore component because of it's cheaper, labor cost, et cetera. And they're handling repetitive, administrative, or specialized tasks. This could be scheduling, billing, social media management, you name it, on a project or hourly basis, often for multiple clients. Virtual assistants work independently. They're using equipment provided by their agency. They're typically bound by practices, internal HR policy. They're typically not going to be connected as an employee. So it's really important that you know the agency you're working with, what they do, how they do it, how they ensure that your employee is, or your virtual assistant is doing everything you needed to do. Because a lot of the time there's a lot of non-compliance that you don't recognize and you're just trusting. Don't trust, do the research, check it out. There are a couple VA companies that I like. And why I like them is because they, one, have transparency in what they pay the person you're utilizing, transparency in what they're charging you, transparency in all of the tools, resources, and benefits that they provide that employee. So one of the agencies I know for a fact, or two of them actually provide health benefits and many different variables for their offshore support. And so I think it's really important that you look at that and that you measure who is going to streamline and take care of the staff that you're utilizing on a day-to-day basis, who is going to really treat them the way that you treat your employees, understanding also security and privacy and all the regulations. When to use a remote employee. So when we're talking remote employee, we're talking someone in the States for this episode, and we're talking someone that could be part-time or full-time, but really is an employee versus a subcontracted individual. Typically, I am trying to access superior talent regardless of location. I am hiring highly skilled professionals. So this could be a telehealth specialized therapist. This could be a billing expert. This could be a HR specialist who are not available locally or prefer remote work. They're looking for remote work. They are ensuring top quality task completion without requiring physical presence in the office. Some of my best employees have been employees that I've hired that I've never even physically met. Can you believe that? So, for example, one of my chief billing officer has been working with me for over 5 years. She is incredible. We've met obviously virtually. We have to this day never physically met. Now, I believe we're going to meet for the first time physically at the Growth Code Conference 2026. Yes, that's a little plug, but pretty cool that, at my own conference, I'll get to meet her. And it's not that we haven't tried, it's just things come up and we live in different states. And I was willing to expand to another state because the talent was so great and I would not change anything. And so looking at that component of when I'm able to hire an employee remote, I'm able to attract the best of the best from all over the country. So the tasks are not requiring physical presence. That's really important when you're looking at when to use a remote employee. So employ remote employees for marketing coordinators, telehealth providers, billing, administrative staff, where work can be fully executed. The other thing when to use a remote employee is increased efficiency. So we're able to free up space, utilize employees when they can demonstrate higher productivity in a distraction free home environment. A lot of this can be data analysts, customer service reps, etc. The other thing that the benefit is cost savings. Typically, I am getting better output for pay from a remote employee. The other thing is flexibility for employee retention. I find that it is a lot easier to retain employees when they have that flexibility because it's something that differentiates their employment experience and it's reducing turnover costs. So, for those who know, not to jump into the financial side, but we talked about total people expense and total facility expense. Together, I give a 70% budget as a reminder between TPE and TFE. When I don't have a facility, I'm able to give more money to my employees. So I have more budget even for my remote employee because I'm not paying for the facility expense in that same capacity. And the software is not as expensive as the facility cost. So it's just important for you to think with those kind of things. Some of you may say, well, I still have to have a facility. Yes, but you would need to utilize that facility space for that employee. So let's say the average space is 100 square feet for an employee. Well, budget it out. What does that cost? So if you're paying $5 per square foot and it's 100 square feet, it's $500 a month that I can actually give back to my employee because they work remote. Other reasons to use remote employees: scalability for growing practices. We can engage remote employees to handle fluctuating workloads such as seasonal patient intake surges, allowing the practice to scale operations without investing in additional office space or equipment. We can leverage technology for collaboration. We can support compliance in remote settings, enhanced employee satisfaction, and overall, we get to reduce overhead costs. So opt for remote employees to lower expenses related to office space, utilities, supplies, all those different factors. For the past 20 years, I've had the privilege of helping pediatric occupational, physical, and speech therapists redefine the way that their business functions and helping them tap into their entrepreneurial spirit. In recent years, I recognized a deficit, which was bringing private practice owners together with the vision of allowing them to connect, learn, and grow. And Growth Code Conference was born. From sunrise to sunset, we offer an opportunity for pediatric, occupational, physical, speech therapy private practice leaders and owners to connect, collaborate, learn, grow from yoga to breakfast to lunch to coffee carts and more. We take you to another world where you are inspired, where you feel empowered, and where you are able to grow to the next level so that we all can change the world one child at a time. Now, when to use a virtual assistant. When we're looking for a virtual assistant, we're typically trying to reduce cost per hour for repetitive tasks. So, engaging a virtual assistant for high volume, low complexity tasks like data entry, email, eligibility checks, authorizations, this is where we can see significant reduction in expense. So now I'm spending $9 to $15 an hour for quality offshore as a contract rate compared to US rates where I'm paying 18 to 50 an hour depending on what I'm paying. So just recognizing that component. I'll be honest with you, I see these businesses in my area that are trying to hire top administrative talent in an office for $9 to $15 an hour. That is not a living wage. And I get like I'm the first one. I hate that statement, living wage, not my problem. There is a point where it becomes my problem because how do I expect to recruit the best talent for $9 to $15 an hour? I'm just being honest with you. And so when we're on a budget of $9 to $15 an hour, really that is an offshore role, in my opinion. I believe every role today is 16, 18, 20, 22, 25, and up. That's my gut for a W 2 employee. Now, I know there are plenty of places that don't pay that, but when I come into town and I start offering $24 an hour to show up and work remote, they're going to come work for me. Just being honest with you. So we can optimize our administrative roles by utilizing VAs for specified tasks. Like I said, authorizations, eligibility, patient scheduling, sometimes depending on your practice. We're also seeing AI play a big part in this. So I think we're going to start to see that offshore virtual assistants and AI are going to eventually compete. Whereas I think we're able to really bring in virtual employees for higher quality output at competitive pricing. Other things for our virtual assistants, data entry, reliability for standardizing processes, scaling support for peak workloads. So I'm finding execution of tasks being more reliable because these offshore employees um, for the agencies that we work with. I'll be honest, they really need the work. And I always tell my virtual assistant partner companies, because I work with outsourced companies for certain roles, I tell them, I want you to pay them the most. I want to be the highest payer in the market for what I'm asking for so that they value these roles. And you may have to take a little bit less margin as a result, but I'll be a long-standing client. And all the agencies I work with three different agencies. All three have valued that and acknowledge that. And I'll be honest, I find I'm working less and less on the virtual assistant side. I'm doing more virtual employees. 95% of my functions are done by a W 2 full time employee who works in the US and is remote and full time. I typically try to prioritize all of my functions to full time output, if that makes sense. So the other things we want to look at with virtual assistants is non-patient facing tasks. I think when there's patient facing tasks, a lot of our patients want to be working with employees that are based in our US area. They are. And so not everyone, and I know plenty of practices that are using, these VAs for patient facing, but I don't personally recommend it. I'm a big believer in more of the back office side. Supporting multilingual needs. Now, that's something that I've had a lot of success with. There are VAs that you can get all over Colombia, Mexico, the Philippines, India, etc., and that has been a really strong benefit. Um, you need to make sure that your VAs are ensuring compliance. So, clear contracts, engage your VAs for tasks where data security can be maintained through HIPAA compliant tools, strict agreements, secure document handling. That is an area that you must make sure because a lot are doing it out of compliance. We can streamline our customer service function and we can often test new processes cost effectively with VAs to pilot workflows, which I find very, very, very helpful. When to use AI over virtual assistants. So I wanted to include this because I think this is a growing thing. In my opinion, AI is going to replace the virtual assistant, not the W 2 employee. So we're going to automate high volume rule based tasks with AI. Did you know that you now can make phone calls utilizing AI for checking eligibility? So now we're able to do repetitive tasks like appointment scheduling and insurance eligibility, where AI powered tools like chatbots and EHR integrations And these different dial.ai's and whatnot can change the way that function is delivered. 24/7 availability for patient interactions can now be deployed by AI chatbots, virtual assistants, Ada Health, Zendesk AI. All these different things are incredible tools. We can scale without incremental costs with AI. There's a data analysis and a pattern recognition that AI is utilizing that I think is going to be just getting better and better, and minimizing human error in compliance sensitive tasks. So we're seeing more consistency with the auditing with AI because we're able to just calculate data and get black and white results. And so that's where I find AI getting really, really helpful. We're seeing personalized patient communications at scale with AI. We're seeing predictive tasks being used, predictive analytics being used with AI, cost effective initial task automation. So, AI for piloting automations like Otter.ai, Rev AI, all different tools we're seeing more and more, processing unstructured data, and then enhancing technology efficiency. So, using AI powered diagnostic support tools like Babylon Health, session transcription tools, et cetera. So, a lot of this is getting, we're in a whole new world. Now, I want to be clear, healthcare is a late adopter. So, where we're at with healthcare today, there are other industries that are 10 years further in AI adoption, but imagine where we'll be 10 years from now. And so I'm just bringing it. Everyone asks me because obviously I have a medical billing company. Um, are you afraid of AI? And I say, I am afraid with the misuse of AI, but I believe that AI can enhance efficiency in what we do. But I believe that quality, coding, and billing analysis will never fully get replaced with AI because the data is not clean enough. But I do believe that AI will fulfill what I'm going to call as the hamster and the wheel functions of medical billing. If not today, then definitely in the next 10 years. So, did you know a 2023 OWL Labs report showed that private practices using virtual assistants for administrative tasks save 20% on labor costs compared to hiring remote employees, freeing up 12,000 annually. Now, again, it's got to be right for your practice, your function, etc., but there are practices benefiting from this approach. And in the words of Ernest Hemingway, the best way to find out if you can trust somebody is to trust them. Thank you for tuning into this quick tips episode of the Private Practice Survival Guide. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.